Hi everybody, welcome to this evening seminar which is around understanding and reducing the risk of bowel cancer. And Sahil has asked us to deliver this seminar because of raising cancer awareness in April, which is very important obviously. And for this talk I'm really excited to invite my colleague Dr. Sadaf Iqbal, who is for the first time at one of these evening seminars. We're going to talk in English and in Urdu as well. So no pressure, Sadaf.
No problem.
We very much appreciate your time in preparing the presentation. We're going to make it informal, so if you have questions, don't be afraid to stick your hand up, ask throughout, and then we'll have a bit more of an open discussion afterwards. So thank you for preparing this, Sadaf, and for spending your time coming to talk to us. I'd like to introduce Sandra Rochdale, who is one of the Associate Directors of Integrated Systems at NHSGM, which is a very posh title, which I'm not sure I quite understand what Sandra does for a job. It's strategic, and it's bringing people together in the right rooms so that there is better connection between community and healthcare providers. So I'd like to invite you to say a couple of words and then we'll get on with the seminar. Thank you, Sandra.
Thank you. I need that as well.
Might as well.
Might as well. Okay. Thank you for that introduction, Louise. So hi everybody, lovely, absolutely lovely to be here this evening to talk to you for literally 30 seconds to say hello. Louise has just done a great job of introducing me, even though she says she doesn't know what I do. But I do have quite a complicated job. I'm not going to bore you with that. My job is basically, as Louise has just said, to get the right people in the right rooms, having the right conversations to try and join up services. You know, they can be very complicated and separate, to try and join those up so that our population, our people who use those services, find it easier to access them and ultimately get the support that they need. So that's kind of my job in a nutshell. I'm here this evening because I have the pleasure of being with Sahil as part of our Rochdale South partnership, that brings together lots of different services along with the voluntary sector to try and really support and do things like Sahil's organised for this evening, to raise awareness and try and really shift the dial to that prevention agenda, which we know that we all need to do. Okay, so I'm not going to say anything else. It's lovely to be here. Thank you very much for inviting me, Sahil, and I will hand over now, I think, to the experts.
Yes, perfect. Thank you, Sandra.
Thank you.
Hello, everyone. I'm Sadaf. I'm a resident doctor working in Salford Royal. Today I've come to do a talk on a little bit about bowel cancer, the screening, and trying to raise awareness around it. I'm also going to speak in Urdu. I grew up with my mum like speaking Urdu with me, so bear with me if my Urdu is not perfect, but I'm going to try. So today's talk is on understanding bowel cancer, which is also known आंतों के कैंसर के बारे में आज मैंने समझाना है और उसके इलाज और आलमात के बारे में बात करनी है. If at any point anyone has any questions, please feel free to just butt in at any point and I'll try my best to answer them. Yeah. Oh, me. I just said bye, Dr. Sadaf. Okay, take care. So, what is bowel cancer? Just a little bit of background around it. So, does anyone have any experience of knowing a little bit about what bowel cancer is, or just directly been impacted in any way? Okay, I'm happy to explain. So, I'll start off by explaining a little bit about cancer. In our body, we have cells, and cells make up all of our different tissues. Normally, they grow at a normal rate, but if they ever grow too fast and multiply in a way that's uncontrolled, that would become cancer, and that's a bit of a definition. So bowel cancer is cancer that affects the large bowel and the rectum. So you can see here the small bowel and then the large bowel. So आंतों के कैंसर क्या है? ये कैंसर पहले को समझने के लिए मैं आपको थोड़ा बैकग्राउंड दूंगी। हमारे बॉडी में सेल होते हैं, वो अक्सर नॉर्मल रेट पे ग्रो होते हैं, लेकिन क्या होता है कभी वो बहुत तेजी से बन जाते हैं। फिर जब ऐसे होते हैं उसको हम कंट्रोल नहीं कर सकते, सो फिर हम उसको कैंसर कहते हैं। और आंत, बड़ी आंत का कैंसर आप देख सकते हैं, ये छोटी आंत है और फिर ये बड़ी आंत है, और यहाँ पे भी जिस कैंसर यहाँ पे होता है हम उसको बोलते हैं। इट्स वन ऑफ द मोस्ट कॉमन कैंसर्स इन द यूके, एंड ये यूके में काफी आम कैंसर अब बन गया है। एंड अर्ली डिटेक्शन इम्प्रूव्स ट्रीटमेंट सक्सेस। सो जितना भी जल्दी आप इस कैंसर को पकड़ ले या इसकी साइंस देख ले, उतना ही बेहतर आपका इलाज हो सकता है। Yeah, let's go.
Sorry, I'm being very bad.
It's okay. What's the last do? Okay, so let's talk a little bit about the symptoms of bowel cancer. So the NHS English made us know the high five just to raise some awareness around it. Some of the signs are bleeding from your bottom or blood in your stool, unexplained weight loss, tiredness that is sort of out of keeping with your day-to-day life, a change in your bowel habit. So if you're going to the toilet and you suddenly notice that you've gone one way or a different way, then that could be a sign. Or any pain or lump in your tummy. Oftentimes we can put this down to sort of other things. Some people might put bleeding when they go to the toilet down to piles, but it's really important to be aware if that's new for you and it started, then it's important to see your GP. So आंतों के कैंसर के आलामात मैं अब बताऊंगी। एक है कि अगर आपका वजन कट जाए और आप देखो कि आपके कपड़े शायद सही तरह से नहीं पूरे आ रहे जैसे पहले हो रहे थे, ये एक साइन हो सकता है। और अगर आप अपने पेट में या कहीं भी कोई गिल्टी आपको महसूस हो, फिर ये भी हो सकता है एक आलामात। ऑल्सो अगर आप जब आप जाते हो बाथरूम में, शायद आपको कोई कब्ज शुरू हो गया है, शायद आपको लूज मोशन शुरू हो गया है जो आपके लिए पहले नहीं था, फिर ये भी एक साइन हो सकता है। और अगर आपको बहुत थकावट रहे, जिससे आप जितना आप काम करते हो उससे आपको ज्यादा थकावट हो, फिर ये भी हो सकता है कि अंदर कुछ आपका शायद आपका कोई कैंसर का साइन हो सकता है। आखिरी साइन जो आपको बताना था वो है कि जब आप टॉयलेट जाओ और आप अपने देखो पकाने में कि शायद आपका कोई खून है या टिश्यू पेपर के कोई खून है, हम सोच सकते हैं कि शायद कब्ज है या कोई ऐसी चीज है, लेकिन ये भी एक याद रखना चाहिए कि शायद ये कैंसर का भी साइन हो सकता है। ठीक है। So I'm just going to talk a little bit about the causes and risk factors, but it's really important to sort of bear in mind that regardless of these, it can happen to anyone, and it is becoming more common in the younger generation as well. So the risk factors are here, some of them being older age, so it's more common in people over 50, smoking, processed meat, having a higher alcohol intake, or having a low fiber diet, so not having as much fruit and veggies in your diet, being obese, and also there's some genetic components as well. There's certain types of colon cancer that can run in families. Aside from this, being male, they're more likely to get it. And type 2 diabetes or any previous inflammatory bowel condition, anything that increases inflammation within the large bowel can increase your risk of developing colorectal cancer. So ये है जो हम खतरे या कैंसर के वजह, वो है उम्र 50 साल के ऊपर होना, लेकिन अब हम देख रहे हैं कि छोटी उम्र में भी लोगों को ये कैंसर होने लग गया है। मर्द होना, खाने में फल या फाइबर कम होना, और डायबिटीज या वजन ज्यादा होना, वर्जिश ना करना, स्मोकिंग और अल्कोहल, ये सारी चीजें कैंसर का रिस्क ऊपर करती हैं। So I'm going to talk a little bit about the diagnosis and tests now. So the first thing I think would be to always seek help from your GP. So you can book in, have a full history and examination where they might examine your abdomen and, you know, find a lump or something previously like we've described, but that's not always a sign. And then we also have stool sample tests that can be given to you by your GP, and that looks at blood in the stool, but you can also be given that through like a screening program. And further down the line, if there are risks or if they are worried about you having colorectal cancer, then we can try and refer onwards to get a colonoscopy, which is a camera looking at the large bowel, and further imaging as well. And then as things sort of progress, there's an opportunity for genetic testing, but that's sort of if you find that it's running in your family and the doctors are concerned about that. अगर आपको फिक्र है आपके बारे में या किसी और के बारे में, फिर आप पहले अपने जीपी को देखो, वो आपकी हिस्ट्री लेगा और वो आपकी जिस्मानी एग्जामिनेशन भी करेगा, वहां से शायद उसको कोई गिल्टी फील हो या उसको आपके ब्लड रिजल्ट्स में शायद नजर आए कि आपका खून कम है, तो फिर आप देख सकते हैं. फिर वो ऑल्सो आपको दे सकते हैं आपके पकाने में टेस्ट, उसमें वो देखेंगे कि खून है या नहीं, क्योंकि अगर खून है जो आंखों से नहीं नजर आ रहा, फिर ये एक साइन है कि शायद आपको कोलोरेक्टल कैंसर शुरू हो रहा है. और आगे जाके अगर वो वरीड है या उनको फर्दर इमेजिंग चाहिए, फिर वो पहले कैमरा डाल सकते हैं और वो कैमरा से बड़ी आंत को देख सकते हैं कि वहाँ पे उनको कोई नजर आए या नहीं. और अब तो जेनेटिक टेस्टिंग भी वो कर सकते हैं अगर आप वो सोचते हैं कि आपकी फैमिली में शायद प्रॉब्लम है. अभी does anyone have any questions so far? Anything that's not clear? Nope. Okay, no problem. Okay, so going on to the treatment. It depends on how early the cancer is caught, it depends on the staging, but one of the main ways that we can deal with the cancer if we catch it early enough is to do surgery, and that would just be to remove the part of the bowel where the cancer is affecting, and usually they have a few more margins that they can take to make sure that any sort of cancer cells that might have been further down are also gone. Alongside this, we can offer chemotherapy and radiotherapy, and it would be guided by like a team of oncologists and colorectal surgeons. They would all sort of meet together and discuss what the best option for your case would be. And as I mentioned previously, with the role of genetics and things, there's more targeted therapies that are also being introduced. But the main sort of thing from this is the earlier you catch the cancer, the earlier you realize you've got colorectal cancer, the better your outcomes will be, and the more likely it is that something like surgery could just remove the cancer and you would be cancer free, but it depends on the timing. So इसके मेन इलाज क्या है? पहले वो कर सकते हैं सर्जरी, वहां से वो जिस पार्ट में बड़ी आंत में कैंसर है वो निकाल सकते हैं, और फिर वो इसके साथ कीमोथेरेपी या रेडियोथेरेपी भी कर सकते हैं, और अब तो ज्यादा टारगेटेड थेरेपीज भी हैं जो वो इस्तेमाल कर सकते हैं. लेकिन इस पे डिपेंड करता है कि कब पकड़ा गया आपका कैंसर और कब कौन सी स्टेज पे है, कि वो कौन सी ट्रीटमेंट आपको दे पाएंगे. इसलिए अगर आपको थोड़ी सी परेशानी है, अगर आप सोचते हो शायद ये है, जितना ही जल्दी आप जाके टेस्ट कराओ, जितना ही जल्दी आप जीपी को देखो, उतना ही बेहतर आपका इलाज हो सकता है. Has anyone ever got the kit in the post? Yeah, okay, my dad as well. Yeah, my dad just got it for the first time. I had to convince him how to do it. But yeah, so NHS have screening for this now. It's being expanded now to between 50 to 74-year-olds. Even if you're over 74, you can call them and they will send, like if you Google the number, they will send you a kit out if you are worried. These are basically what we call fit tests, and as I mentioned previously, that your GP can do it. These are the screening test version, where you send a sample of your stool and they look and see if there's any blood in there that you might not see with your naked eye. And then depending on what that shows, they can further invite you for colonoscopies and further investigation. But the main thing with this is to try to catch the cancer early and before other symptoms might show, because for a lot of people, the symptoms might show later on, whereas the cancer has been there for a while. And as is on this poster, I think, healthy lifestyle choices to sort of reduce your risk as well. So cut down smoking and hopefully aim to stop. Eat a diet full of fiber, fruits and vegetables. Try to lose weight if that's something that you're struggling with. You can also see your GP for. And increasing the amount of exercise you're doing are actually protective against a lot of different cancers, not just bowel cancer, but the main one for this would be to try and reduce processed meat and increase your fiber intake. मैं उर्दू में एक्सप्लेन करूँगी अब. स्क्रीनिंग है NHS ने बनाई है 50 साल से 74. I didn't know the Urdu word for 74, so 74 साल तक कर सकते हैं. वो आपको पोस्ट में मिलेगा. वो आप अपना टॉयलेट जब जाओगे आप अपना सैंपल दे सकते हैं और वो देखेंगे कि इसमें खून है या नहीं. तो फिर अगर खून है वो आपको बुलाएंगे और टेस्ट करने के लिए, और हर 2 साल बाद आपको पोस्ट में ये मिलना चाहिए. इसके साथ आप अपने दिन बाय दिन चॉइस बना सकते हैं कि अपना रिस्क रिड्यूस करने को. सो अपना वजन हेल्थी रखें, सिगरेट ना पिए, ज्यादा फाइबर खाएं और अपना वर्जिश किया करें as well. So if anyone's affected or wants to read further about anything that I've spoken about today, it would be, there's 2 resources that I would recommend. The first is Macmillan Cancer Support, and they do a lot of work and create a lot of helpful resources regarding this, and also the NHS Bowel Cancer website. It's very concise and easy to read information about what we talked about today. So conclusion, I think I mentioned it a few times, but the earlier we can try to get tested and screened and, find out that we may be suffering from colorectal cancer, the better your outcome would be. So I'd really encourage you to, encourage your parents, your friends, your family, anyone that you're worried about, to engage in the screening, but also keep an eye out for those symptoms that we talked about. And if you are worried, then it's always worth seeing your GP and kind of going from there. But yeah. So yeah, thank you very much, everyone. That's everything. Yeah.
Thank you so much, Salah. That was great. Before we open for questions, I'd like to invite Joe from Living Well. We were talking about support in terms of other organisations, but Living Well is a fantastic organisation that works in Rochdale, and they also work on the issue of bowel cancer, risk reduction and early identification. So, Joe, I'll hand over to you and then we'll take some questions.
Thank you very much. So yes, Sonia and I are from Living Well, and we work in the borough of Rochdale, so that's Haywood, Middleton, Rochdale and the Pennine. And our service is the specialist prevention lifestyle change service in Rochdale. So a lot of the things that were mentioned today are what we can support with. So we offer free support. People can get one-to-one support for up to 6 sessions. And our main service is around smoking cessation, stopping smoking, alcohol reduction, having a healthy diet and having a healthy weight, and also moving more and being active. So our coaches can support people one-to-one to achieve that sort of lifestyle, which ultimately will reduce the risks of getting cancer. The reason we're here today is because it's Bowel Cancer Awareness Month, so we've been doing a lot of work in April around this subject, and really just want to support everybody here today in encouraging people to do their FIT test, which is the test that you get through the post when you're 50 plus. You don't have to wait for symptoms. The idea is it's to detect cancer early. So you just do the kits as soon as you get it and you pop it in the post, and it's very easy. I did mine a few weeks ago, and it came back clear, and I know that's okay for a few years. But obviously, if I notice any changes in my body, in my bowel habits, then you still have to go to your GP and get that checked. Don't wait for the next kit to come. But yeah, we just want to raise awareness of having a healthy lifestyle. We can support people to achieve that, and we've got lots of great stuff, groups, walks, lots of support in Rochdale. We have a lot of information at the back of the room, and we've got a lot of information about bowel cancer. So if you would like to take something with you to have a look in your own time and maybe talk to your families about, please come and see me and Samia. That's it. Thank you.
Great, thank you.
Over to you. Oh, right. You got the gist. Do you want me to put that on for you? It's all right. You're an expert.
So just I'm going to translate what Joe just said into Urdu. I just wanted to add something as well. When we do our education and awareness in the groups, I always talk about knowing your body. So some people might be disgusting, it's your poo. It's part of you. It's human nature. So get to know your poos. I've said it. I do this on the radio. Get to know your poos. What's regular for you? What's normal for you? What does it look like? What does it smell like? What color is it? It's fine. It's human nature. So get to know what's normal for you, whether it's your poos or your breasts for breast cancer, or even anywhere else for your body. Men can get breast cancer as well. And something else that we kind of do in our groups is, as Muslims, because most of us here are Muslims, our body is like a gift to us, and we have to look after that gift. So Allah has created all of these illnesses to test us, to kind of, take away our sins in some sort of form. And He has created the cure to all of these illnesses, except for old age, obviously. We can't do anything about that. So we have an obligation to go and seek medical treatment. So get to know your bodies, and if you feel like something's not right, even if the doctor says there's nothing wrong with you, keep on going back and say, no, I know my body, I know how I feel, there's something not right, and sometimes you might find something. So please do, keep a track of your body, what's normal, and don't be afraid to keep going back. Just badger them until they find something. And if there's absolutely nothing wrong with you, then that's great. That's absolutely great. Right, so my Urdu's not that good. So living well एक सर्विस है हेल्थ एंड वेलबींग के लिए. So ये बताएं हेल्थी लाइफस्टाइल आपका बाउल कैंसर का रिस्क कम कर सकते हैं. So living well हमारे पास हेल्थ कोचेस है जो आपका डाइट, आपका वेट के साथ सपोर्ट कर सकते हैं. 1-to-1 हेल्थ कोचेस आपके साथ सपोर्ट कर सकते हैं. अगर आप फिट होना चाहते हो तो वॉकिंग ग्रुप्स है. अगर आप वॉकिंग ग्रुप सेटअप करना है तो ये भी हमारा साथ भी कर सकते हैं. हम फ्री ट्रेनिंग देते हैं. Oh my God, I've just forgotten the service. So the health coaches, हाँ हमारे पास बहुत ग्रुप्स है, या आर्ट ग्रुप्स है, ये फाइनेंस मैनेजमेंट ग्रुप्स है, ये सोशल ग्रुप्स है. हमारे पास चैट्स भी है. अगर आप लोनलीनेस और आइसोलेशन है और अकेले लग रहे तो ये हमारा कैफे में आ सकते हैं, ये बात कर सकते हैं. ये हमारे चैट्स भी आपको फोन कर सकते हैं अगर आप घर से बाहर नहीं जा सकते. हम फ्री ब्लड प्रेशर चेक्स भी देते हैं. हमारे पास बाउल कैंसर के बारे में बहुत इंफॉर्मेशन है. अगर चाहिए तो आप ले सकते हैं. और कुछ सवाल पूछना है ये हेल्थी लाइफस्टाइल्स के बारे में और बाउल कैंसर के बारे में और आपका हार्ट के बारे में, प्लीज़ हमारे पूछें हमसे. हम जितना एडवाइस दे सकते हैं हम देंगे. अगर हम एडवाइस नहीं दे सकते हम साइन पोस्ट करेंगे आपको. ठीक है? थैंक यू.
So does anybody have any questions? Fabulous. Do you want to go ahead? Project well, yeah, great. Thank you.
With the bowel cancer, how is it not aware of any, but if you get bowel cancer and screening everything, say you're in early stages, what's the likelihood of it coming back? Or is it one that is?
It depends on how, I think if it gets classified into how far it's basically spread, with metastasis being the worst because it's essentially spread outside of the bowel into other organs. I think if it's in an isolated area and of your bowel and they're able to remove that and the surgery is successful, then they do like checks, I think, every few years to see if it's come back. But I think if it's in the early stages and the cancer has been removed, the tumour, then it's a low likelihood of coming back, unless it's genetic, at which point you might be at higher risk of it returning.
Yeah, I think to add to that, sometimes, if you have something once, you're more likely to have it again. So someone who's already had bowel cancer would be more likely to get it again, just because that's the nature of illness. Similarly, if you've got close relatives who have it, you're at higher risk. So if you know that through your family, that's something to look out for again. But the people who see you and treat you would know that, and they have like appropriate follow-up screening and tests that they would look at, sort of identify it early. Any other questions from anyone else in the room? Would you like to speak in the mic?
What's the side effects after people go to a normal lifestyle? Are there any changes?
Yeah, usually it depends on obviously where the cancer is and the site of the surgery and how much of the bowel that they remove. In certain cases, people, because of the extent of the bowel that's been removed, or the area, for example, if they were to remove lower down towards the rectum, and where you're more likely to have something called a stoma, which is, I don't know if you've ever seen somebody with a stoma, but like a bag which essentially would collect your feces and things instead of it being excreted normally. But that does depend on sort of what the surgery is, and a lot of people, initially it's obviously a big change to have your poo coming out of into a bag instead of how you would normally go to the toilet. But people still can, with the right support, the right group, stoma nurses and support groups, they can still live quite a healthy life. And then with chemotherapy and then radiotherapy, they come with their own side effects. And I don't know if anyone's sort of known anyone who's been affected by chemotherapy, but that can take a toll on the body. But again, it's something that there is support for and groups to help you with.
Yeah, I don't have anything to add to that.
Yeah.
Does anyone else have any questions? I have one question, and I guess it's for all of our speakers. If you had a family member, so I guess everybody in this room will know someone over the age of 50. I didn't know that we screened over the age of 50,
Yeah.
so I've learned today. So everybody, I reckon if we all go away and tell even 3 people that we know over the age of 50 that they should be getting bowel cancer screening, we could all make a massive difference. We might lead to someone having an earlier diagnosis. You could save someone's life. So I think we should all do that when we leave. I'm definitely going to do that with older people that I know. But how would the speakers suggest that you address the issue? Like, people might not want to engage with it. They might not want to think about it. They might be scared. They might think, oh, it's disgusting. I don't want to think about it. I just don't want to do it. How do you encourage people to go to send those fit tests off? And then a second question, what if you're not getting the screening through the post? What should you do? Fabulous, yes, thank you.
Thank you. So I can share some personal experience actually, and I think you asked a really valid question. So a few weeks ago, my husband did his fit test, and he got the dreaded call to say actually there was blood in his poo, and therefore he needed to go and have a colonoscopy. And actually that's quite a scary thing, and we had 2 weeks of being very very scared, although my other one was like, this is that, to the other one, just kind of said that everything was going to be okay. But actually, it was okay. So we went, we had colonoscopy, and he had polyps, and he had them removed, and everything was fine. So that's my little personal experience of it, which I think is important, because I think to answer your question, Louise, one of the important things is that we talk about those things. Now, for my husband, he did not have a single symptom. He did the fit test without even considering that there might be an outcome that we weren't expecting. So that for me was a real piece of learning that, you know, I always sort of thought, well, you probably got a bit of an inkling, but actually, oh, it was absolutely fine. And clearly, there was an issue, even though it wasn't cancer. So that's very much encouraged me. I'm 56, I got mine through the post the other week, and I to be honest, thought, that's not a very nice thing to do, is it? But actually, you've just got to do it. A lot of screening isn't the most pleasant thing that we'll ever do. It took me 5 minutes. It's in the post, and that's great, isn't it? And I think there's something about, to answer your question, Louise, about how we just talk really, really openly and in just a very frank and real way about what it's like, because it isn't the nicest thing to do. But actually, I'm very glad that me and my husband did it. I'm certainly very glad that my husband did it. I've got my fingers crossed that I'm going to come out with a negative test, but if I don't, well, I know what will happen. So I just think it's about the more events and things like this that we can do, that really sort of just have honest and open conversations, the more and more will make people feel more comfortable about it. But I think we should be honest about it's not the most pleasant thing to do. Kind of not what we talk about every day, is it? But actually, it's really, really important. I think sharing personal experiences of doing that is really important.
How did you convince your dad to go, Sarah?
I'm just really annoying. I'm just like, every day I'd come home from work and I'd see it on the table. Yeah, you've still not done it. Still not, like you've not had a poo in a week. You've still not done it. Like, and then honestly, one thing that made it easier for him was I just tried to explain to him, like, it's about taking ownership of your own health in a way. Nobody's going to come, like the GP's not coming to your house. Nobody's coming to your house to force you to do the test. It's for your own, like you said, peace of mind, or like we talked about today, about finding it early and treating it early. So I kind of guilt tripped him in like a dad, you need to be here, you need to be healthy. But I think an important point is just sort of taking ownership for your own body and the people that you care about, and openly having those conversations with people to encourage them to do that, and kind of busting any myths that people might have. Like, I think a lot in our community, with a lot of different things, there are different thoughts or misconceptions that people have. So one of them being, I feel fine, so why would I do it if I feel fine? And then actually explaining you can feel fine. It's some of these cancers, it's not until way later on that some of the signs start showing, and at that point your outcome may not be as good. So yeah, a bit of guilt, and then just
Persistence.
Yeah.
Great. Thank you. Do you have anything to add, Jo, in terms of?
Well, yeah, same sort of thing. I think being honest, but I think having a bit of a laugh about it as well, because it's not pleasant, and it's one of those subjects that we perhaps don't want to talk about, but we all do it. Even the king does it. So it's just something that happens to us, and just it can inject it. It's great. Like, I've heard it called, I won't repeat all the words I've heard it called, but there's been a few different names for it. We call it poop scoop in our house.
Right.
But, have you done your poop scoop? Yeah, it's in the course. But yeah, just be honest and open, and it's just really important that you don't think, I feel fine, I don't need to do it. The whole point of cancer screening is to catch something early, and the more we tell everybody we know and spread it, like you said, that's a really good idea, that people will do it, and it just becomes just something that we do. Okay.
I think what Sonia said, you know your body.
Yeah, I think that was great.
Who's best for you or your doctor? My doctor's best. Your best, because you know yourself more than your doctor. 5 to 10 minutes every week.
Yeah, that's great.
I see them. You are the important doctor. You are the best doctor. You know me what you do. Being, I think, what Dr. Sutton has said is really over cultural barriers.
Yeah.
Sometimes we don't want to talk.
Mm.
We don't want to know. There are cultural barriers. Being that you consider the champion in the past, I always say 90%, including doctors, and compared to it, I think it's important that we look for it. Any change in our body, our health, of course, the DNA, it's very important. If you have heart, diabetes, and cancer, it's like
Yeah.
your life. It may not be. Again, cancer can come with you. It's not that we really have this food, remain healthy still. Yeah, genetics. I think we must not shy away from asking our GP. What you said in my presentation, early detection is safe.
Yeah, absolutely. Yeah.
Of course, you asked a question about quality of life. Cancer treatment starts from chemo, radio, and proton beam therapy, and many other things. Of course, people do get delayed for cultural reasons. They suffer in silence. Eventually, when it's too late, and then they have to go to the extreme level of treatment. I say no to wonderful. After you want to see myself. So it's very close to myself. I'm not on my level. Say कि बात की है उसके ऐसे है 50 साल के बाद अच्छे प्रोफेशनल अगर हम में जो तीन लोग तीन हमको जा सकता है और अगर आप ऐसे ही अगर आप चैंपियन बनने शुरू कर दें तो फिर आप देखिए जो आपके स्तर में या आपके में being supporting role is very, very important in the family who is suffering with cancer. God forbid. This is something it hits the mind, mental health, and of course the physical health. तो ये है कि अगर हम इसको हम बात करेंगे इसके बारे में जैसे सर ने कहा कि हम अपनी अपनी बॉडी का खुद ख्याल रखेंगे तो हम बहुत से जैसे I used to do like breast cancer awareness. Many of our sisters we train them as a breast cancer champions. So and then it was like going into the women and girls levels and talking about it. And at the same time, we're educating men as well, partners. These signs and symptoms can really make early detection. So that's the whole idea. So I think it's important that we keep talking and not shying away. First protocol is doctor. But no, before you go to Sonia and Joe, every week we hear Monday and Thursday. Never Sonia and Living Well has missed our session since Dr. Luis has started developing the Kim seminars. It's more than a year now. It's our second year. But I think we never missed Living Well, seminar in the evening. So thank you for that, Sonia. But again, the cholesterol, the cardiovascular, smoking cessation, so many the topics we open in our Kim Center here in seminars. I think that's all early detection. When Sandra talks in our neighborhood strategic meetings and planning, and she really emphasizes on families and having active life, exercise, and out and about. And the last meeting we were having in a Academic Center, it was like a brainstorming, and we went out to see the park and the streets and what is the state of the health outside. So it's important that we connect with our people, with our neighbors. But certainly more importantly, that we come to open sessions, health open days. The health seminar that would be one topic every 6, 8, 10 weeks or something. Health open days are more often here in Deeplish, and we take really great care of engagement. So please do ask questions. उर्दू में अगर आपको सवाल पूछना हो पूछें माशाल्लाह आप बहुत अच्छे डॉक्टर हैं प्रोफेशनल हैं आपको शायद नहीं होना चाहिए if you have questions जरूर All speakers can speak Urdu here while listening to Dr. Sadiq. Thank you.
Thank you.
Thank you. Any other questions before we finish up?
Can I just share something?
Please.
So please correct me if I'm wrong because I don't know everything. In our religion, knowledge is power. And as a community, we should share that power. So if you've learned something today, share it with someone else. You know, as Muslims, it's an obligation, especially when it comes to our health. Do share with other people. The more people you share it with, the more people's lives you can save. Even if it's just for the reward. You know, if you save someone from dying from bowel cancer, do you know how much reward you get from that? So हम जो आज सीखा है ना, आप शेयर करें अपने फ्रेंड्स के साथ, अपने फैमिली के साथ, फर्द अगर आपको किसी को बस आप बता सकते हैं बाउल कैंसर की बीमारी के, तो आपका कितना रिवॉर्ड मिलेंगे ये सोचिए। तो आप शेयर करें अपने फ्रेंड्स के साथ, अपने फैमिली के साथ, शेयरिंग भी आपका रिवॉर्ड मिलेंगे। ठीक है?
While I'm here, does anyone have any topics that you'd like to hear about in particular for our next seminar or the seminar after that? Any health topics that you think, I want to understand more about that, or I know someone who's been affected by that and I didn't know what to do, or I've got curiosity around this thing?
Autism in children.
Autism, okay. I'll try and find someone who talks about that, yeah. Autism, yeah, okay.
Bill diabetes, Bill mental health, over
Mm-hmm. Mm-hmm. Oh, that'd be good, yeah. I don't think I do, so that'd be great.
about the burns.
Yeah, so her niece is down to do burns, yeah, yeah.
She did say she would.
Yeah,
I think it's important children.
yeah, okay.
Like we said before, anxiety, depression.
Yeah,
Yeah, that's really big in your
children.
mentality, yeah.
Yeah, maybe we could sort of think about putting a session together. Is that another suggestion? So. Oh, right, okay. Oh, right, okay. If you think of anything and you don't want to say it out loud now, you can talk to Sahil afterwards and Sahil can email me. Or if you think of something next week and you think, oh, I want to know about that, if you just tell Sahil, then he can email me and tell me. We'll try and find a speaker that's interesting. Thank you, everyone, so much for coming.
Thank you.
And thanks to all our speakers. Thank you.